Hi, my name is Haley and I'm going to be doing the skills video administering oxygen through a nasal cannula. So for my supplies, I usually have my patient, two different nasal cannulas, and my hand sanitizer for hand hygiene. So first I'm going to grab my supplies, walk into the patient's room, shut the door for patient privacy. I would have a flat, clean surface to put my supplies down on. And then I would perform hand hygiene. And then I would introduce myself to the patient. Hi, Mr. Smith. My name's Haley. I'll be your nurse taking care of you today. The doctor has ordered some supplemental oxygen, so I'm going to place a nasal cannula for you today. I'm going to verify the patient's name and date of birth. Mr. Smith, can I get your name and date of birth? Perfect. Thank you. So I'm going to take a clean nasal cannula and to always explain to the patient what I'm doing. So Mr. Smith, this is a nasal cannula that's going to go into your nose and then around your ears and then down around your chin, and it'll be a snug fit. This is going to connect to the oxygen on the wall. So I'm going to grab my tubing. Now this end will be connected to either more tubing, depending on how much tubing is needed, or the flow meter on the wall. We always want to make sure it's green and that it does say oxygen. The flow meter will be set to whatever the provider is prescribing. Normally it's anywhere from 1 to 6 milliliters a minute. So that'll be plugged into the wall. All right, Mr. Smith, we're gonna get started, okay? So this is gonna go in your nose and then around your ears. Oh, 1 second. Need more tubing. Okay, making sure that fits. And that's snug, but not too tight. We don't want to create any pressure wounds. Also, we will need to assess as the patient has this that there's no pressure wounds on his cheeks, behind his ears, or even can be some right here on his upper lip. All right, Mr. Smith, is that comfortable for you? Perfect. Alrighty. I will hand hygiene. And then I will leave the room and close the door for patient privacy and then go document the procedure. Alrighty. I'm going to open up my patient's room back again. Hi, Mr. Smith. So the doctor has decided that you need a little bit more oxygen. So we're going to switch out your nasal cannula. I'm going to perform hand hygiene again. This time I'm going to be using a mask. All right, this is a nasal mask. It just gives you more oxygen than the nasal cannula. So what I'm going to do, this that is plugged into the flow meter, I would unplug that and immediately plug this back into the flow meter, double checking that it is in the green oxygen flow meter, set at the right. I'm going to take this nasal cannula off and discard of it in the trash. All right, Mr. Smith. Now this is attached to the wall already. What I'm going to do is I'm going to place this over top of your head, on your face. This little metal piece is going to pinch down on your nose, making sure it's a snug fit, okay? And then we can pull here on the sides just to make sure that it is a snug fit. And then I'm going to press down on your nasal cap, the little nasal metal piece. All right, let's just make sure. Oh, sorry. Just need to be a little bit more snug on your chin. Now this bag is going to inflate, giving you more oxygen. No need to mess with that. That's just with the mask. At this point too, we just want to make sure when we're checking in on our patient that right here on the ears and on the nose is not breaking down and causing any pressure ulcers. You could put a little piece of gauze underneath any place like that, just for protection for the patient. Now, Mr. Smith, are you comfortable? Perfect. I'm going to perform hand hygiene yet again, and then I would leave my patient's room and document as needed.